How does diagnosis of hypertensive crisis affect treatment? Have you ever wondered how the diagnosis of a hypertensive crisis can change the way treatment is given? Understanding this can be vital, especially in emergency situations. A hypertensive crisis is when blood pressure rises to dangerous levels. It can be classified into two main types: hypertensive urgency and hypertensive emergency. In hypertensive urgency, blood pressure is very high, but there is no immediate damage to organs. This means that while the situation is serious, it does not require immediate hospitalization. Instead, doctors will typically increase oral medications to lower blood pressure gradually over several hours. Patients in this category are often stable and can be monitored closely without needing to stay in the hospital. On the other hand, a hypertensive emergency is much more severe. It involves acute damage to vital organs like the brain, heart, kidneys, or eyes. This condition demands immediate medical intervention. In these cases, intravenous medications are used to quickly lower blood pressure, often within minutes to hours. Patients experiencing a hypertensive emergency are usually admitted to the intensive care unit for careful monitoring. The way a hypertensive crisis is diagnosed plays a huge role in how treatment is approached. For emergencies, the goal is to reduce blood pressure quickly to prevent further damage to organs. However, it is important to manage how fast blood pressure is lowered to ensure that blood flow to the organs is not compromised. In contrast, with hypertensive urgency, the focus is on a slower, more controlled reduction in blood pressure. When healthcare providers are faced with a hypertensive crisis, they must act swiftly. They assess the severity of the situation by looking at the patient's medical history, current medications, and conducting tests to check for any organ damage. The choice of medication and the speed of treatment are tailored to each patient's specific needs and the organs that may be affected. In summary, diagnosing a hypertensive crisis is essential for determining the right treatment plan. Whether it is a hypertensive urgency or a hypertensive emergency, the approach to managing blood pressure can vary significantly. Understanding these differences can lead to better outcomes for patients facing severe hypertension.